You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. This is a second part of my interview, the part 2 with Dr. Mo Zakhireh, the desert's busiest board-certified plastic surgeon, and he's been on the show for more than 15 years, and he's got a lot of great photos. Dr. Zakhireh, welcome back. So today we're talking about mommy makeover and facelifts, and you have a bunch of photos with the mommy makeover, and so let's start there. So who is a candidate for mommy makeover? Like, who is the ideal in your mind? Who should get this done?
So when patients come in now, I mean, things have changed a little bit because the definition of mommy makeover has evolved over the years. It used to be just a tummy tuck, but now it's tummy tuck and, let's say, liposuction of the back. And then it evolved to tummy tuck, liposuction, and breast augmentation. And now, because of the Kardashian sisters, patients come in and they also want their fat that we take off, they want it put back into their butt. So it's really interesting because then you can make the body anatomically so much more correct and really bring out the curves. And I always tell the patients, you know,
what do you call it? Is it a butt lift? I mean, what is it?
Correct. We call it Brazilian butt lift.
Okay.
And what happens is, as a result of pregnancy, a lot of the stored fat in the body has to go towards feeding the baby or babies. And so a lot of the fat that is stored in the hips of the mom, and that fat disappears. And so after pregnancy, their butt sort of relaxes and falls because it's literally an empty skin envelope. So, you know, at the same time that we're doing everything now, we're taking the fat into a sterile container and we're rinsing it, we're cleaning all the oils out of it, and then we're putting the fat back in.
Is this only for the thinner person? Well, or some people that just want more shape?
Oh no, it's for everyone, and there are people coming in that want more shape to their butts. Now we're finding out more people coming in that want more shape also to their hips.
Okay.
So the trends are changing.
Men and women?
You know what? I've done it on men also, definitely. Okay. Yeah, and you know, men go through the same thing. We go through hormonal changes. As we age, our testosterone level falls and estrogen to testosterone ratio changes. So unfortunately, we get kind of more fat in the chest area and we lose a lot of fat in our buttock area. So it's really interesting. I mean, I actually have a lot of my own personal friends coming in, and it's really funny because they say, don't tell our friend so-and-so that I'm doing this. I'm like, okay, fine. So they come in and I do liposuction and fat grafting, and then our friend so-and-so comes in and says, don't tell our friend so-and-so. I'm like, okay, so it's a big secret between everybody. But you know, you see them at a pool party and everybody looks great, so that's what counts.
And one day they're going to admit, well, I went to go see Dr. Zakhireh. Oh my goodness, I went to Dr. Zakhireh.
Right.
It all comes out at once.
It's really funny. What would you like to cover now?
Well, you have a man right there, so let's talk about the guy.
Yeah. So
that's man boobs, right?
Correct. So this, well, I don't like to call it man boobs. It's scientifically, it's gynecomastia.
Okay.
And man boobs has a negative connotation. That's what, you know, guys say to each other when they're trying to be mean, and
when they're insulting
it's
each
locker room talk when they're trying to insult each other. So this guy is a very healthy, athletic, 28-year-old gentleman, and he has essentially struggled with this for all of his life. You know, people like this gentleman, I mean, he actually looks pretty good, right? So, but for whatever reason, they are very focused on this, and they're very they can't wear tight t-shirts. They don't want to take off their t-shirt at the beach or at the swimming pool. This particular gentleman didn't want to wear a tight t-shirt at the gym. And so, you know, we took him in, we liposuctioned him, and, you know, I was actually really surprised at how much we got off. We got off 1,100 cc's, which is, you know, it's over a liter. So imagine he had half a liter of solid fat in each chest. So here's a side view. So before he, you know, he had, you know, gynecomastia, male breasts, but afterwards he looks buff in his t-shirt and he's down to muscle and his chest is very hard.
So is this kind of an easy one for you? I mean, it's technically demanding, but pretty much an easy fix.
It is. It's probably, honestly, this is one of those surgeries, it's a home run for the patient. It changes their life. Their personality, again, blossoms. But for the amount of work that I have to do, it's, I do less work on this one. It takes me about an hour, hour and a half to do the whole thing. But it's life-changing. It's amazing. This lady is a mother of 4 children. And she's 43. And she had her children, and, during, kind of raising the kids and stuff, she gained some weight. And then she realized, okay, now the kids are older, so I need to get healthier. And we ended up doing liposuction of the back and the inner thighs and tummy tuck on her. Notice that she actually had so much excess skin, not only below the belly button, but also above the belly button.
Yeah.
So this is the kind of patient that you can't really do liposuction on them, because that skin above the belly button is really going to sag like a Shar-Pei, you know?
Okay.
So what you have to do is, again, make that Brazilian cut, bikini cut incision, and then undermine the skin, tighten the muscles, pull the skin down, and make a new belly button for them. And the after is right there. Now, I wanted to, the reason I wanted to share this after picture with you is I want you to notice that the incisions on the tummy tuck incision is long. Now, these are 6 weeks out, so they end up fading and they become the same color as the rest of the skin. But notice that the pannus on the lady was very large.
It's the fold, the pannus?
Yes, correct.
Like the overhanging roll.
The fold was very large, so this is all about tailoring. That's all it is. So the larger the fold, the more I have to take back the incision to where the fold actually starts. Yeah. And then I cut everything off, and
she has like an hourglass now. Like, she has a shapy look.
Absolutely beautiful
compared to before.
Right, and then also again, we did the breasts, and then we put some fat in her buttocks, and we gave her such a beautiful shape, and she is so happy. So with her, we also did her breasts, and we put fat in her buttocks to really restore her figure. Now it's really interesting because the husbands, they come in and they're giving me a kind of a dirty look at first. They're like, they're like, you know what, this is money I have to spend, and I could be buying ATV or something, and why are we doing this? And quite frankly, it's an expensive procedure to go through. But guess what? It's totally worth it, because afterwards, when the husbands come in, they're like smiling, because they got their mojo back, because their wife got her mojo back. So it's really interesting, because I've had now 12 of my tummy tuck patients get pregnant, and the first patient that came in that got pregnant, I flipped out. I was like, what are you doing? What have you done to my results? And she kind of sheepishly shrugged, and she goes, Doc, you made me look so good. My husband started chasing me around the house again. You know what? That puts such a smile on my face. I mean, how can you go wrong with that?
I had a plastic surgeon on the show, and he said, Randy, men and women are different when it comes to plastic surgery. At 50, certain level of success, the man gets the car and the watch and the nice house. And women may want the same thing, but women still want to look pretty.
Yes.
And so to the insensitive man that says, no, you're not going to do anything. Mm-hmm. Sometimes, do you think the men get in the way?
Absolutely. The men
They don't get it?
They don't get it. And it's not because they're trying to be assholes. They just, men and women think differently. But after a procedure like this, they always come in and they go, Doc, happy wife is a happy life, because their wife looks in the mirror and she loves her figure and she loves life. She totally...
Well, self-confidence is attractive too.
Absolutely.
I mean, period.
Mm-hmm. And they're committed to their life at that point. They go to the gym. They want to go out hiking and walking with their husband. They just in general, they want to go out and then just live life again.
So you're a big hiker. I know that, right? I mean, you do cycling, you do all that stuff. But do you see a lot of your patients like on the bump and grind?
Yeah.
Like after their tummy tucks and they're wearing their Lululemons, they're back.
I tell you, Randy, I see a lot of my patients too early after their procedure, and I have to stop in the middle of the trail and tell them to, watch what you're doing, because it's just too early for you.
It affects the healing process?
Absolutely. They could pull something, they could fall and hurt something. So, but yeah, I mean, they are that motivated that when they see what they got going on, they are almost fanatic about, not gaining that weight, or, and I tell them, I go, because we take the fat off, your metabolism skyrockets, because guess what? Fat produces estrogen, and estrogen is slowing down the metabolism. Okay. So as soon as you kind of clean out that fat, then their metabolism totally skyrockets, and if they want to, they can get 6-packs.
So they must get like brand new wardrobes.
Oh yeah, actually they do, and it's really interesting how we kind of formed a co-op with our patients. So these patients who have to get new wardrobes and they get rid of their let's say business clothing and things like that, we ask them to bring it in so we can donate it to...
Oh, that's nice.
Yeah, like different shelters for, battered women, or they're trying to get women started back up get them back into the workforce. Let's say they have a job interview to go to. And also the same thing with breast augmentations. We have them bringing in their under, garments or their bras and things like that, and it helps a lot. So it's kind of, I like that about thinking outside the box, and kind of helping out the community.
Now with you, obviously results are number one. You want natural, good results. But do you get your kicks or the most excited with that personal transformation that they go through?
Yes.
Like the self-esteem changes?
Yes.
The life changes?
Absolutely. To me, that's the biggest gift that you can give me, to have the privilege of watching that person blossom. I mean, that is just such a powerful moment in someone's life. And again, like I said, it has a ripple effect. It has a ripple effect on their family, on
they're more fun to be around when you feel good
yeah,
about yourself.
Big time. Absolutely. So Randy, look at the side view on this patient. Look at the way her curves just flow. It's art, and it is so beautiful to see a patient like this in a tight-fitting black dress, just dressed
like perfectly
up.
Flat.
It's beautiful. Flat abdomen and, muscular and athletic. That's what it's all about. It's amazing. The other issue that I want to bring up actually is, after you tighten the abdominal muscles, then the stomach doesn't have that much room to expand. So the eating habit of the patient changes, and also their cravings change. So let's say they used to love to drink soda or, eat a lot of cake and stuff. They just don't crave it anymore.
So after a mommy makeover, their cravings go away.
Absolutely.
Things like that.
And it just becomes a natural thing that they crave healthier foods, salads, microgreens, things like that. So, okay. I mean, I have so much more to go through, so I know we're running out of time.
I'll try not to interrupt, because I know you complain every time I interrupt. I'm just sitting here trying not to say anything, Dr. Zakhireh.
Sorry, I didn't mean to make you. Okay, so this lady, it's really interesting. Again, 40-year-old lady, had 4 pretty heavy pregnancies, but she had to get back to work a lot faster. So she asked me, she was like, can we do something that is drastic enough to change my body, but, kind of, because she knew that tightening the abdominal muscles, takes longer to heal. Tightening the abdominal muscles takes 2 to 3 weeks to heal from, and she only had 1 week.
So what your goal is to what? Get rid of that fold right there?
Correct. So what I did is, again, she had the excess skin above the belly button, so I couldn't do a liposuction on her. It just wouldn't tighten up. So I had to make the incision, lift up the skin, left the muscles alone, and then just pulled the skin down, cut out the excess skin, and made a new belly button for her. And in addition to that, we did some liposuction and some Brazilian butt lift. And boy, I tell you, talk about that black dress. I mean, she actually looks so athletic, and she's got that flat abdomen. And I was just thrilled with the results, Randy. I mean, it was beyond my expectations.
You're big on the natural belly button. You taught me that about 15 years ago.
Yes.
You said, look at the I can spot tummy tucks everywhere,
right,
if they have one, because the tummy tuck looks smeared or like fake.
Correct.
This looks natural.
Yeah. Yeah, and this looks natural. Yeah. Yeah, and it's, I fell in love with the belly button, and I call it the unsung hero. We've talked about this. Its job is to be there but not be noticed. If you notice the belly button, then there's something wrong. And, so what happens is the majority of doctors that do tummy tucks, they don't take the time to invert the belly button. And you got to take the time to invert the belly button.
But logically, everybody knows this, right? Why aren't they doing it?
I don't know. But, so, that's my biggest pet peeve with tummy tucks. And so I really, really take the time to do the belly button correctly. And, I think the reason why is because doctors are usually in a rush to get done. Because to do the belly button correctly costs me about 45 to 50 minutes extra. It's almost an hour, So, but you can't skimp on the belly button. It's like making a beautiful cake and not putting icing on it. It just doesn't work.
It doesn't work.
Yeah. So.
Okay, good. So when it's all done, what does she say to you?
Oh, God.
She's healed up and
She is just over the moon. And she says, my gosh, I just did not realize that I wasn't planning on even putting on a bathing suit, but now I can put on a 2-piece bikini and look great. And I don't look like I've had 4 kids.
She's like an Insta model now.
Oh, yeah.
Like Instagram.
And again, these are the ladies who get their mojo back. They're no longer frumpy. See, that's what I hear a lot from patients is they say, at some point in my life, I realized that nobody looks at me anymore. I became unnoticeable, And so you're giving that back to them, and it's so important, And also it's important with their relationship with their husbands.
Now we are short on time, and I know you wanted to show me those facelifts.
Okay, Randy, I just need to run this last patient by you because I'm so proud of her. This lady had 7 pregnancies, and her children are all grown adults. Okay? So, I just love what we were able to accomplish for her, and she's just another one of those.
Wow. That's a youthful, it's like you're giving them a younger body.
Correct.
Right?
And you got to have respect for a lady who's had 7 pregnancies,
She's got to be showing off that abdomen all over the
definitely.
place.
Yeah, for sure. So anyways, I just, I'm really proud of that result. Now, let's go to the face and neck lifts. So this lady she'd be mad at me if I said her age. Let's say she's in her upper 60s. She's a dear friend to our practice. She's been, in our practice even before I went there.
Okay.
And she came in and she was like, Doc, I feel like I'm young inside, but I just don't look it, What can you do for me? She had the bands, obviously, and she was concerned about the jowling area. So she said, I want those taken care of. What else do you think I need? And I said, you have some lines around your lips that, I would recommend fat grafting those lines. It's not so much to make you look ducky or fill up the lips. The majority of the fat, when you put it in the lips, it disappears. But as it disappears, it recruits blood supply to that area. So then the tissues in the lips literally look and feel younger.
Like they fill in a little bit?
Correct.
On their own?
Yeah. So you're restoring more blood supply. The vermilion border gets that red color back. You know how as we age, our vermilion, the red in our lips kind of fades away. So you're getting, literally physiologically, you're making that area younger. So, and I told her, I said, your lower lids are hollow. Let's put some fat there. And this is a dead giveaway. When the temples hollow out, the patient looks aged. So
like a skeleton look,
correct.
Kind of a thing.
So I said, let's put some fat there for you. She agreed, and so this is what she looks like after the fact. Now, Randy, how...
I got to tell you something. This is really good. Anybody we got to hold this up for a while.
Yeah, so how many years younger would you say she looks?
Probably 15, 20, 25 years younger.
Yeah, so
probably, without exaggeration. I think anybody would say that. And she also looks prettier.
And overall, she just looks, and her lips look beautiful. They don't look ducky. They have their, Cupid's bow shape to them, and they just look very natural.
Now, you told me her age, and we're not supposed to say the age, but this is actually incredible. She looks at least 25, 30 years younger than her age.
Yeah, I mean, I'm just so...
Is this what she used to look like? Like, do you think you kind of turned her back to where she used to be?
Yes. So all of these patients, they all come back and make the comment that, you know what, you made me look like myself. You didn't make me look like anybody else. And that is their biggest worry. That's the first thing that they tell me.
And by the way, looking at the before and after, like the first one, you would say that's an older woman. Nobody would say that's an older woman.
Correct.
On the after one.
Correct.
So it's like a,
So, what I like to tell them is that we have changed the definition of aging gracefully, because this lady just looks like she's aged gracefully. And that's what it's all about. So, Randy, I know we're pressed for time, but this lady is, again, she would get mad if I shared her age, but she's in her upper 60s. And she came in and she had sort of the same issues as far as the banding went and the jowls. Now, she's very athletic and she's a hiker. And so, you can obviously tell that she's taking really good care of her skin. She comes in religiously for esthetician services with us. But the one thing I pointed out to her, she's very hollow in the temples, very hollow in the in lower leads. And so she came in for a face and neck lift and fat grafting. Oh, wow. And she just is over the moon happy. She looks and feels the same age that she is on the inside. Very energetic, very positive, and again, her relationship with her husband is better for it, and she's just genuinely happy.
They tell you this? I mean, they come back and they say, everything's better.
Absolutely, and they don't have to tell me. They look, a lot of times the couples come in together and they look well bonded and happy.
Do you ever not recognize them? Like, let's say time goes by, but they've made such a big change. It's like you're going, wow.
Yeah, absolutely. And, it makes you feel good. It makes you feel good that they've been able to keep the results and build positively upon the results. So, for example, when the patients after this surgery, I tell them the best thing that you can do is to come in for regular esthetician services, because I see the long-term results now, and the patients who are snowbirds and they go away, they don't have access to good medical estheticians, their skin ages a lot faster than
So final message, somebody watching this, they don't like the way they're aging. Maybe they look in the mirror, they don't like it. After their children, they're not bouncing back the way they want to. They don't like the way their body looks. What do you say that? But for whatever reason, they're putting it off. Mm-hmm. Or maybe they have a tough time doing something nice for themselves. Mm-hmm. What do you say?
So we're not your typical cosmetic surgery office in the sense that we don't have a big ego. So patients are always nervous when they come in, but as soon as they come into the door, they're like, oh my God, this is so warm and hospitable and welcoming. And at the end of the day, I started my career in academics at the University of Utah, and my job is to properly educate the patient. And if they choose not to do surgery with us, that's fine. There's no hard sell, there's no hard feelings. I've taken the time to educate them so that they can make the proper decisions for themselves.
All right, so if they call, there's no consultation fee, they could see you.
Correct. Right? Absolutely.
Well, Dr. Zakhireh, always a pleasure to have you on the program.
Thanks, Randy. Same here. I really appreciate it.
You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.